Procure is a European project funded by the Fourth Healthcare Programme that brings together 26 partners from 13 European countries. The consortium is represented by a diverse sort of public and private organizations which are deeply involved in healthcare public procurement. Its main objective is to conduct a comprehensive assessment of public procurement practices across the EU. The assessment will focus on the impact of pandemic in procurement organizations, and by means of comparison, Procure will determine what's changed in relation to the pre-pandemic scenario, and also what new strategies, action plans, policies, and lessons learned have been incorporated to public procurement as a result of the COVID crisis. So the final objective of Procure will be making current practices more resilient and efficient all over the Union to ensure that public healthcare systems are ready for whatever crisis the future brings. Through the activities planned, Procure has the following objectives: to undertake a thorough assessment of healthcare public procurement practices in the Union, to facilitate healthcare public procurement organizations and policymakers to gauge and track their state of readiness and identify opportunities for improvement in procurement processes in response to future emergencies and pandemics. And finally, to identify the lessons learned from the health and care procurement responses to COVID-19 and outline new or improved national and regional strategies on public procurement. The main outcomes of Procure will be addressed to improve the understanding of procurement operation and impacts during health crisis in 13 member states, reveal key elements for successful public procurement practices in the healthcare sector, suggest new or improved national and regional strategies on public procurement that make current practices more resilient and efficient, and finally, to increase coordination and cooperation between the European member states. The team involves 16 public procurers, 1 procurement organization, 1 supplier association, an alliance of private hospitals, 4 supporting organizations, and 3 affiliated entities. This will enable us to join forces in order to map, assess, and reinforce the capabilities in healthcare public procurement at national and regional level to increase the preparedness for the future public health emergencies.